Doctor's Privacy. Hello, my name is Taylor. I'll be your student nurse today. How are you?
Doing all right.
That's great. Alright, so put my gloves on. Now your doctors asked us to do a couple assessments, a cardiac, respiratory, neurological, HEENT, and a musculoskeletal assessment. Is that okay with you?
Mm-hmm.
Okay, can I get your name and date of birth, please?
Paul Robinson, June 2nd, 1998.
Okay. Alright, we're gonna start with a respiratory assessment. I just want to hear your lung sounds. And let me know during any time if you get uncomfortable or have any pain, okay? Do you struggle with any breathing or any tightness in your chest?
I have asthma.
Okay. I'll make sure the doctor knows that. Alright. I'm assessing his right upper lung. Can you do one big deep breath? Okay, going to the left upper lung, one big deep breath. Okay. Going down to the left lower lung, one big deep breath. Now going to the right lower lung, one big deep breath. Now moving laterally to the right middle lobe. Can you do one big deep breath? Then going laterally on the left side, so it's to the left lower lung, another big deep breath. Okay. I heard clear vesicular sounds, which is good. I didn't hear any crackles or wheezing, no adventitious sounds. Now I'm moving to the back, posteriorly. Can I get one big deep breath? Right upper lung, now moving to the left upper lung, one big deep breath. Then moving down to the left lower lung, one big deep breath. The left lower lung, I'm sorry. And then going to the right lower lung, one big deep breath. Okay. I heard clear bronchivesicular sounds, no adventitious sounds. So that's good. Oh. Sorry for those technical difficulties. Okay, now, okay, so now we're in the season of COVID and people getting sick. So I'm just gonna let you know about the 10 deep breaths following a cough. So what you wanna do is take one big deep breath. Can you do that with me? And to do a cough. And what that does is just, helps expand your lungs, because we don't usually expand our lungs when we breathe like on a normal basis. And coughing helps to expel any mucus or sputum that you might have. And if you, like when you just did that, if you had any sputum or mucus, I would assess it for any colors or like any kind of odors like that. You should do that 10 times an hour or once every commercial break if you're watching a movie or a TV show. And do you have any questions related to your respiratory sounds? Okay. Now we're gonna do the cardiac assessment. Okay, you have to put this stethoscope on your chest. Let me know if it's cold or you're uncomfortable anyway, okay? All right, so I'm on the right side, second intercostal space. Listen to the aortic sound. Okay, now I'm gonna move over to the left side. Listen to the pulmonic, left second intercostal space. Okay, now moving down to the third intercostal, listening to Erb's point. Okay, moving to the fourth intercostal space, listening to the tricuspid. Okay, now I'm going to move over to the mid-clavicular in the fifth intercostal space, listening to the mitral. Okay, cardiac sounds were loud, S1 and S2 are present. I didn't hear anything adventitious like murmurs. Okay, let's see your hands. I'm checking for capillary refill. Less than 3 seconds. Less than 3 seconds in both upper extremities. Now while I'm up here, I'm just gonna check for edema. No pitting in the right extremity. No pitting in the left. Can you turn your head that way? No JVD, and can you turn your head this way? No JVD present. And while I'm up here, I'm just going to show this is the radial pulse, brachial, and axillary underneath the armpit. And then the carotid is in this little groove in the neck. Never check both at once because it can cause the blood flow to be decreased in the brain. So now I'm going to go down here and check the pedal pulse, which is about a 3+, and then the posterior tibial pulse, 3+ in the right foot. And then while I'm down here, I'm just going to check for edema. No edema. And then do the same for the left side. Pedal pulse is 3+. Posterior tibial pulse, 3+. No edema. And for pulses, you have your popliteal behind the knees, and then femoral in the crease in the thigh right here. Okay, that was the cardiac assessment, which everything went well. So now we're gonna move on to the musculoskeletal assessment. Now, do you have any problems with range of motion in any of your joints?
In my right shoulder.
What happened in your right shoulder?
A football injury.
Okay, so I'm gonna make sure not to assess the shoulders because he does have an injury there, but I just want to let you know, don't ever try to like overexert that area because you want to cause any further damage. Okay, so now I'm going to check for range of motion in both his elbows, starting with the right elbow. Okay, can you flex it for me? Okay, extend it. Okay, I didn't hear any crackles or pops. Now, can you flex it against my resistance? Okay, and then extend it against my resistance. Okay, no issues there. Okay, now turn. All right, can you flex your wrist? Extend it? Hyperextend it? Okay, no crackles. Okay, can you flex against my resistance? And can you extend against my resistance? Just do it like that. Okay. Same thing on this elbow. Can you flex it? Can you extend it? Okay, can you flex against my resistance? And can you extend against it? Okay. Now same thing with this wrist. Can you flex it? Extend? Hyperextend? Okay. Can you flex against my resistance? Okay, leave it just like that. Now extend. Okay, I didn't hear any crackles or any pops in any of these joints. Now I'm going to assess the lower joints. I'm going to do the knee. Okay, can you extend it? Just kick it out. Okay, now flex it. Bend it. Okay. Now, can you flex it? Bend it. Bend your leg. Okay, and then extend it. Kick it out. Okay. Can you go ahead and extend your leg for me? Okay, then flex it, bend it. Okay. Can you extend it one more time? And then flex it, bend it. Okay, I didn't hear any crackles or pops. Okay. I'm gonna place my hand on your ankle. Okay, can you point your foot down? Okay, that's plantar flexion. Okay, can you extend it back up for me? Dorsiflexion, I didn't feel any resistance. Any crackles or pops. Okay, can you point it down again for me? Okay, and then kick it up again. Okay. The same thing on this leg as well. Placing my hand on the ankle. Can you point it down? Okay, can you flex it back up? Okay, can you do that one more time? And then flex it back up. Okay, I did hear popping in the left foot. So I'm gonna make sure just to note that down for the doctor. All right, can you stand up for me? Okay, can you just walk a little bit? All right, you can walk back and sit down. Okay, his gait was good, fine. No swaying, no, I don't have any. I'm not worried about his balance, but if I was, we could perform 2 different balance tests, which is the Romberg's, which will have him stand feet together, eyes closed, and hands like this, and I put both of my hands on the side of his body and just like wait a couple seconds to see if he sways. Or we can do the tandem walking, which is, heel to toe, heel to toe. But we're not worried about that. So the musculoskeletal assessment went well, and now we're gonna do the HEENT assessment, which means I'll just be assessing your head, eyes, ears, nose, and throat. So for your head, right now it is symmetrical. There is normocephalic. Have you had any head traumas or head injuries? Okay. And I'm gonna just palpate to see if I feel anything. I don't feel any abnormalities on his face. Do you have any ear problems, hard of hearing, or anything like that?
Oh, just ear problem.
What kind of ear problems?
They just get stuffed up easily.
You go to the doctor for that? Okay. I'll make sure to make a note of that. Your ears are symmetrical, normal size for your head, and the top of your ear auricle lines up with the eye canthus, which means it lines up, your top of your ear lines up with this crease in your eye, and the way that I know that is if I drew an imaginary line from the top of your ear to the eye, it will line up perfectly. Do you have any problems with your eyes? Do you have is it hard for you to see anything?
And I wear contacts and glasses.
Okay. When's the last time you went to the eye doctor? Do you know?
Last month.
Okay, well that's good. Alright. And now I'm gonna do an eye assessment. So what I'm gonna do is I'm gonna shine a light in your eye to make sure the light that I shine in the eye needs to be 100% constricted, and then the opposite eye needs to be 50% constricted. Okay, well I'm assessing your eye now, see any redness or any conjunctivitis, any inflammation of that sort. Just gonna... Your eye is 4 millimeters, 100% constriction in the left eye and 50% in the right eye when I did the light. Now I'm shining it in the right eye, 100% constriction and 50% constriction in the opposite eye. So his eyes were pearl, which is pupils are equal, round, and reactive to light. Now I'm going to do the A, which will make it perla to see if it accommodates. So what I want you to do is don't move your head at all, just move your eyes. And look at, for instance, look at the TV behind me, and then look at my badge. Look at the TV behind me, and then the badge. Okay, his eyes accommodate, so he passed the perla. Now what we're going to do is I'm going to look at your nose. Your nose is midline. Do you have any problems with like breathing, any sinus issues?
Just allergies.
Okay. Can you close one nostril and breathe out the other one? And do the opposite. Okay. And now I'm going to give you an imaginary glass of water. Okay, so when you drink that water, when you swallow, I'm going to put my hand on your trachea just to make sure it's midline and you have no risk of aspirating or choking or anything like that. So go ahead, take a sip and swallow. Okay, the trachea is midline and there was no risk for aspiration. Okay, now I'm going to ask you to open your mouth. I just want to look inside. Okay, inside your mouth is pink, moist, wet, and no risk of tooth decay or anything of the sort. And close your mouth. Okay, so that was the HEENT assessment, and everything went well with that. Do you have any problems like with your tonsils or anything related to your throat of the sort? Okay. Now I'm just gonna do the neurological assessment. Just gonna ask you a couple questions. That's basically what it is. Do you know where you're at right now?
Your house.
Okay. Do you know why you're here?
Helping you with the video.
Do you know who's the president right now?
Joe Biden.
Okay. So he was awake, alert, and oriented, which means I could just say AAO times 4. He knew where he was, what was going on in the orientation. Now, if he didn't, we would do the Glasgow Coma Scale, which basically means a person who is, unconscious. That's what we usually do. And if you have a score of less than 8, that means you have some severe brain damage. But if you want a normal range, 13 to 15, which means that you have mild to no brain damage. So that's what we want. And do you have any questions for me today?
No.
So we performed all the assessments, and I'll make sure I'll let the doctor know of any findings that I found. Thank you.